kratom is a leaf. It's a plant. It's actually very similar to the coffee plant, but it has a number of different active substances, or what we call alkaloids, within that leaf. And some of them can be stimulating, and some of them bind to opioid receptors, for example. So one of those active alkaloids, or one of the active parts of the kratom leaf, is called mitragynine. And that is the active component that binds to opioid receptors. Now, the metabolite of that the metabolites can be more specific to binding to opioid receptors and be more potent. So one of those metabolites is the 7-hydroxymitragynine, or 7-OH, and that's what people are starting to use more frequently than just the kratom leaf itself. The kratom leaf, often people will find it coming in a powder or in capsules, where that powder is placed into capsules, and it's not nearly as potent. It doesn't have the same sort of effect, this like really high peak and a short half-life. But that metabolite that only binds to the opioid receptor is acting much more like fentanyl, where you get a much higher peak, you get a much higher sort of high or euphoria, and it lasts for a very brief amount of time. And you can get the same withdrawal that you would get with fentanyl, where you have the same sort of withdrawal symptoms as other opioids, where you can feel kind of flu-ish, where people will describe flu-like symptoms, where they get chills and shakes, runny nose, watery eyes, all of those same things. And so if you happen to be using kratom, whether you are doing so knowingly or not, and you realize that when you don't have it, you start to get these withdrawal symptoms, know that that's something that there are medications for that we can help with.